Ginger is famous worldwide for being really good for your health. People have used it for a long time because it helps with tummy problems and makes you feel better if you're feeling sick. But even though it's usually seen as helpful, there are times when it might not be good for you. In this article, we'll talk about when ginger might not be the best choice for your health. Knowing these situations can help you enjoy ginger's good stuff while making sure you stay healthy. Let's talk about 9 potential side effects and health risks of eating ginger. Number 1. Bleeding disorders. If someone has a problem where they bleed a lot, they need to be really careful about what they eat. Ginger can make blood thinner, which might make bleeding worse for people who already have this problem. The things in ginger, like gingerol and salicylate, can make it harder for blood to clot. This means bleeding might last longer, especially for people who already have trouble with bleeding. People with these kinds of problems should talk to their doctors before eating ginger. Number 2. Diabetes. Ginger might make blood sugar levels go down, which could help some people. But for folks managing diabetes, it can be risky. If blood sugar drops suddenly, it can cause dizziness, weakness, or even make someone faint. So people with diabetes need to be really careful about how much ginger they have. Some folks with diabetes might also have tummy issues with ginger. It's good at helping digestion, but for some, it might make things worse, like making them feel uncomfortable or bloated. This can make managing diabetes harder because tummy problems can mess with blood sugar levels in unexpected ways. Number 3. Heart conditions. Using ginger might not be safe for people with heart problems. Ginger can affect how blood moves through the body and change blood pressure. It has stuff that can make blood flow better and might speed up the heart. For folks already dealing with heart issues, this could make things worse and cause problems for their heart. Also, ginger can make blood thinner naturally. That's good for some people, but not for those with heart conditions who take medicine to thin their blood. If they have ginger with their medicine, it might make the blood too thin, causing issues like bleeding too much or getting lots of bruises. Number 4. Pregnancy. During pregnancy, having lots of ginger might raise the chance of losing the baby, as some studies suggest. It's better to be careful and not have too much ginger, especially in the first few months when losing the baby is more likely. Ginger might also give heartburn and tummy trouble to pregnant women, especially those with tummy problems. Talking to a doctor and not having too much ginger can help keep both the mom and the baby safe. Number 5. Low blood pressure. Ginger has special parts like gingerol and zingerone that make it unique. These parts make blood vessels wider, which lowers blood pressure. But for people who already have low blood pressure, having ginger can make it worse, so they need to be careful. Also, ginger can make the body produce some hormones and chemicals like serotonin and norepinephrine. These can lower blood pressure even more. This might be bad, especially for people who often have sudden drops in blood pressure. Number 6. Surgery. Before surgery, it's vital to watch what you eat, as some foods and supplements can affect how your body responds to anesthesia and medicines given during the operation. Ginger, for example, might increase bleeding during surgery, making things more complicated and raising the chance of problems afterward. This is to reduce risks and ensure the patient's safety and health during the whole surgery process. Number 7. Gallbladder issues. When your gallbladder isn't working well, it has trouble releasing an important substance called bile, which helps break down fats in your body. Ginger, a spicy herb, can make the gallbladder produce more bile, causing discomfort and making the problem worse. Ginger can also thin the blood, and this might be risky for people with gallbladder issues because any issues with this sensitive organ can lead to bleeding and serious health problems. If you're dealing with gallbladder issues, it might be safer to choose other soothing options, like chamomile or peppermint tea instead of ginger. These alternatives could help manage the problem without making it worse. Number 8. Medication interactions. If you're taking specific medicines, especially for things like blood clotting, high blood pressure, or diabetes, it's important to be careful about using ginger. Ginger has natural properties that can affect how these medicines work. Ginger can make these medicines work too well, making your blood too thin and increasing the chance of bleeding. And if you're taking medicines for blood pressure or diabetes, ginger can mess with your blood pressure and blood sugar levels. This can mess up the effectiveness of your prescribed treatments, so it's important to be cautious. Number 9. Being underweight. If you're too skinny, you need to be careful about what you eat because some foods can make it even harder for you to gain or keep a healthy weight. Ginger is known for helping with digestion, reducing nausea, and easing inflammation. But for people who want to gain or keep a healthy weight, ginger might cause some challenges. If you're already struggling to eat enough to keep your weight up, ginger's ability to reduce appetite could make it even tougher. If you're too skinny and want to figure out what to eat, it's a good idea to talk to a doctor or a nutritionist. While ginger is good for many things, it might not be the best choice for those trying to gain weight, and there could be other options that work better. If you like the video, make sure you hit the like button and subscribe to our channel. Thanks for watching this video.